Hi everyone, this is Sabiha from Bangladesh and nice to meet you all. So today I would like to present some of our recent works that is about experiences and perceptions of MH-based services in the humanitarian context in Bangladesh. So this is our Bangladesh team, Bangladesh C4C team from Dhaka and Coxbazar. So this is the geographical context of the Rohingya community in Bangladesh. So they came from the Rakhine Strait of Myanmar and placed themselves at the southern part of Bangladesh, named Cox's Bazar. So these are some photos from the camp. Regarding MHPSS, though it was there, but during influx, the demand increases in very high, and different NGO, INGO, and government organizations are trying to provide MHPSS services with lots of challenges like lack of skilled service providers, insufficient clinical supervision, inadequate ethical competencies, and limited attention to service providers' well-being. We did a qualitative exploration, and we had 4 FGDs and 2 in-depth interviews with the different stakeholders. Our findings can be grouped into MHPSS provider group, local experts, community members, beneficiaries, and MHPSS manager and coordinator group. For provider group, they had they are having some experiences and challenges like marital conflict and GBV cases are high. They have some anxiety-related cases very high, and those who are working with disability, they have mentioned that dealing with disability often requires active involvement of family members, but that ultimately leads to dropout. Provider group also mentioned that there is a lack of space to work to ensure confidentiality. As I have mentioned earlier, dropout rate is really high there, and the beneficiary Rohingya community lacks mental health issues, or they take mental health issues very lightly, according to provider group. Provider group also mentioned their perspective on clinical supervision. So according to them, management or our organization doesn't properly understand the actual need for clinical supervision, so they prefer online supervision, and also they would ask for single session therapy, as dropout rate is very high. They have already mentioned that they mentioned that there is a lack of clinical supervisor, and also dealing with adolescent psychotic cases are very difficult for them. Moving on to local expert. So according to local supervisor, there is a lack of fixed structure, and each organization has their own system to provide supervision. But basic structure of the different organizations of supervision process are similar, and they often need prescriptive model of supervision. There is a lack of skills and lack of basic knowledge among MHPSS providers. Beneficiaries often ask for materialistic benefit, but MHPSS doesn't do what to do then. They face difficulty setting boundaries. And in Cox's Bazar context, as we have mentioned that during influx, we need to recruit a lot of MH-based staff from outside psychology and applied psychology background. These counselors often misperceive the importance of clinical supervision, and they often feel inferior to take clinical supervision. MH-based staffs feel uncomfortable working with sensitive issues like psychosexual dysfunction. Often they have some MH-based staff have some of their own health issues and real life crises. So according to local experts, MHPSS staff seeks direct guideline to provide intervention. They have some self-care, and they need to deal their own emotional issues also. Case identification and making the proper referral is a need for the stuffs they have mentioned. And sometimes client become dependent, and counselors need to set the boundary, or need to have though that skills to how to be more professional. According to local experts, organizational level, there is a lack of expert or technical persons for clinical supervision. According to community members' perception, they mentioned about restlessness, uncertainty about future, and they feel that their child's development is hampered. They have serious concerns about child's future, as there were schools with no education system, and due to that, they feel that childs become irritated and family quarrels are going on. Regarding the effect of tension and continuous chronic stress, they feel that they often face many health conditions like diabetes and some other illnesses. Community members perceive MHPSs, so they mentioned that they have limited understanding about the counseling and MHPSs service process. And some mentioned that the breathing relaxation and the process may help them temporarily, but they need to have a peaceful country, peaceful place, and get back to their own land, or something like, or many more freedom. And female beneficiaries, they have mentioned conflict between husband and wife, and they also reported restlessness among women. Female beneficiaries, those who receives MHPS's experience, they had good experience, and they have tried breathing exercise, and they find it very peaceful and calm. According to managers and MHPS's coordinators, different types of supervision modes and structure are available. Organizations are willing to provide regular supervisions, but it's often doesn't happen. Administrative and clinical supervision often merge in this context. MHPSs usually seeks clinical supervision about issues like suicide, how to deal with pregnant women and their stress, domestic violence, severe psychotic symptoms, diagnosis, and making referral. Managers recommends to start from the basics, as basics is lacking. They also recommended to be flexible, and timing of the supervision is important, as they have seen. They recommended to ensure learning for all members of the group, and the supervision should be supervisee centric. And they also recommend that we need to implement local knowledge and expertise along with international. And well-being of the counselor is a very crucial issue to handle in the supervision session. So to conclude, we have now some recent experiences from Bangladesh humanitarian context about Rohingya community, and it is indeed contributed to our development of supervision intervention program. Thank you, everyone.